give us a little brief overview of what the National Reference Laboratory does?
NRL is a company established by Mubadala Health, which is part of Mubadala Investment Company. We are about a little over a decade now in operations. We've started in 2010 with a network of laboratories. The central lab, we have the hub and spoke model here in the UAE, where we have our central lab in Abu Dhabi and a spoke across the UAE. The lab was originally developed and managed by LabCorp for about 10 years and now continues to be in partnership with LabCorp moving forward. The vision and mission of NRL is really to develop testing that we've seen gaps here in the region. As the healthcare develops, you would require the scope of laboratory services available in the country, and that's what's been the mission in focusing on highly esoteric tests available with a fast turnaround time, best quality and patient care. As I've just said, we've been in business for a bit over a decade, and we've always believed that we've shown our success in the market with the service offering, with our contribution to the community, to the hospitals, and directly to the patients. But the pandemic really offered us a great opportunity, as well as a challenge, to actually test in a real world, in a pandemic, our offering. So if I look at laboratory services in general, so it's well known globally that the laboratory services or the lab medicine diagnostic component represent about 70% of the physician decision when it comes to the lab test. So it has a significant contribution to the medical decision making, medical and clinical decision making. This has been a bit of a challenge historically because the lab was always at the back end of the healthcare value chain. And we've always had that challenge where patient, when they think about the lab role in the healthcare value chain, was always very limited. You and I as patients, we go see a physician, and we don't think what happens beyond that. Personally, running NRL for over 10 years now, I've always found that challenge to change that perspective. We've done a great job. NRL is the thought leader in the region in that domain, but thanks to the pandemic, it just accelerated the importance of laboratory. Who doesn't know what PCR is today? PCR is a highly complex test, is not a straightforward routine test. So it gave us the opportunity to really showcase our capabilities. NRL is actually governed by a quality management system, and that's cascade all of our operating systems, lab information systems, technologies we use. And the magic word is standardization.
And how important has it been for you to have a skilled workforce available to do that?
Talent, right? So people talk about quality. Quality of organizations, quality of services. It really stems and starts from the quality of people, your talent. And in healthcare, there's the pandemic showed us a lot of gaps globally. One of them is shortage of skilled healthcare workers. And being in the forefront, really, of the pandemic, we had to keep an eye on this. And this was a great testimony for